Trial process breakdown. Patient pathway. Baseline assessment is appointment 1 and a face-to-face assessment. At the baseline appointment, we would ask that you answer any trial-specific questions the potential patient may have. If the patient is happy to continue, you should then go through the informed consent process as detailed in the earlier slide. Please indicate yes or no on the trial database whether the patient has consented to take part in the qualitative sub-study interviews. A copy of the completed consent form will also need to be uploaded to the trial database.
Face-to-face baseline assessment pathway. Following patient consent, please enter patient contact details onto REDCap. This must be completed prior to randomizing the patient. Please also complete the baseline demographics form on REDCap. Again, must be completed prior to randomizing the patient. The patient completes their ACQ5 and the EQ5D5L either on paper or online during the assessment. Site staff can enter the details directly onto REDCap during the consultation or after if preferred. However, it must be the same day. The patient completes their health economics questionnaire post-consultation in the waiting area. This should be entered onto REDCap by the site staff the day of the baseline assessment when on paper. Randomization. Following the baseline data collection, the GP or site staff randomize the patients via the study database. Patients will be randomized to either the standard care arm, which is salbutamol plus low-dose inhaled corticosteroids, or the intervention arm, which is the combined inhaler formoterol plus ICS, plus the low-dose inhaled corticosteroid inhaler. Please explain to the patient that the combined inhaler relieves asthma symptoms in the same way as salbutamol. Note that there is a maximum of 12 puffs per day for the combined inhaler as per the SMPC guidance. Follow-up assessments. Month 1. Patients will be contacted by telephone at 1 month, appointment 2, and you will need to complete the 1-month follow-up questionnaire on the trial database with them. Months 2 to 11, which is the primary outcome data collection, patients will receive an automated text message asking them if they've had a severe asthma attack needing 3 or more consecutive days of systemic corticosteroids, predominantly prednisolone. Patients are asked to reply yes or no. You will follow up the yes replies with a short phone call as detailed earlier. Exacerbations can occur at any time during the trial, but the number is expected to be low. If they respond yes, the exacerbation information and prescriptions for corticosteroids and antibiotics, if applicable, given to treat their asthma attack will be collected. For months 3, 6 and 9, these are patient-facing documents only. No site involvement unless paper copies are requested by the patients. Patients will be asked by text or email to complete their EQ5D5L and the Health Economics Resource Use Questionnaire via a link to the database. Please note that patients should be sent a paper copy of each questionnaire on request only at 3, 6 and 9 months. Reminder text and/or emails will be sent when patients do not respond to initial text enquiries or complete questionnaire data within the required period at each time point. Follow-up assessment continued. Month 6 compliance check. GP or site staff will need to review the previous 6 months medical records to retrieve the type and number of SABA inhalers prescribed and enter the number and details onto the trial database. Month 12 assessments. Medical records review. Prior to the patient consultation, the GP or site staff will need to review the previous 12 months medical records to confirm the self-reported systemic corticosteroid use, predominantly prednisolone. Please identify any unreported courses of corticosteroids and retrieve the type and number of all asthma inhalers prescribed using the forms on the trial database. A summary table on the trial database will be visible to help with these checks. GP and site staff will need to add any exacerbation data that was not reported in the relevant section of the trial database. The patient consultation. There is a 12-month end of trial assessment. This can be face-to-face or telephone call. You will ask the patient if they've had an asthma attack that needed 3 or more consecutive days of corticosteroids. If they say yes, please complete the 12-month exacerbation form on the trial database with them. Patients will also complete their ACQ5 and the EQ5D5L and the final Health Economic Resource Use Questionnaire online, or on paper if they request it. The questionnaire data will need to be entered onto the trial database by a member of the site staff or the research team following the appointment if completed on paper by the patient. Retention. Retention is just as important as recruitment. Ways you can help us improve or maintain retention: ensure patients are aware of the importance of us collecting follow-up data, completing questionnaires, and attending the final clinic appointment. Explain processes clearly to them and ensure correct contact details are recorded.